We had to be nimble. We had to react, and we had to step up.
(1918). The flu pandemic kills 2,000 people in Westmoreland County. It infects 33% of the county population, overwhelming Westmoreland Hospital and most others in the country. 2020, the Excela Health system is severely challenged by COVID-19. The virus was new and evolving.
We had to be nimble. We had to react, and we had to step up our game in the sense of being able to meet the needs of our residents. And it was an unknown situation for everybody. And so I think we all needed to evolve, and I give great credit to our medical staff and our medical leadership here to be able to do the appropriate research and investigations to determine what would be best for our particular community.
So are you now better management?
I think so. I think that this really pulled our team together. When you think about managing this an unknown situation like we did, I think it made everyone step up and look at things differently, because there was that level of uncertainty that I think it required our reliance on one another to come up with different approaches and different ideas. So yeah, I think we're a much better team and a much better organization as a result of it.
What has the financial impact been?
Well, I think it's, you can only imagine it's been pretty substantial, especially when you looked at the first 3 to 4 months when we had to shut down our elective surgeries and a lot of the procedures. It had a really large financial impact on the organization. In a matter of 3 months, we lost over $30 million.
Electives will be coming back now?
Electives are starting to come back. I think we did see a spike or an increase here in November, December, and January with an increase in COVID admissions. So we had to selectively limit our surgeries and things of that nature for the second time, but that was more a result of seeing increased admissions. So as now we've come into this next few months here in February and March and now into April, the elective surgeries are starting to come back. And so we're starting to open up our ability to take care and do procedures and surgeries and things of that nature that we had to kind of withhold.
But you also now feel that you're more competitive with UPMC and AHN?
It's interesting. I think our residents here prefer to have care here within the community, and so I think that even though there are other organizations that are providing care with in and around our region here, I think it's the preference of our society or our community, for no better term, to really want to have it local and close to home. And so I think we are committed to be able to do that by recruiting the top physicians and medical care providers here to be able to get the best care that we can within Westmoreland County.
Do you think people here in Westmoreland believe that care at Excela is equal to that in Pittsburgh?
I think that has evolved. I think when you take a look here over the last 1.5 to 2 years, and the commitment we've made in recruiting medical staff and physicians here and building the team that we have from a clinical perspective, I think we match up as well as anyone in this region when it comes to the medical care that we provide and the care that we provide within Excela.
And where will you focus more energies, clinical energies, going forward?
Well, I think that there's always the base of any organization is your primary care physicians, because that's the basic area of where patients go to see when it comes to receiving care initially is their primary care doctor. So we're always looking to make sure that we solidify our primary care physician base here. But I think it's also as a result of us also enhancing our surgical capacities here. So whether it's in cardiology or orthopedics or thoracic surgery or other, OB, cancer, we're always looking to be able to go out and recruit the best physicians here. So I think that has been a commitment that we've made in building our medical staff here. So like I said earlier, I think I'd hold our medical staff and our people up to anybody in the region.
You're currently, obviously, the largest employer in Westmoreland. Do you see employment increasing at Excela?
We do. We currently have nearly 5,000 employees as part of Excela Health. We're always in need and looking for, in particular, nursing and other, clinical support staff here. So the demand has been great as far as having enough adequate nurses to take care of the patients. So we see that employment in healthcare will continue to increase and demand increase. We are a pretty large economic driver within the community, and when you look at the 5,000 employees plus their families, we play an important role, and we feel a certain obligation to be able to be here for this community and keeping the money within our communities and within small business within Westmoreland County.
Excela's first encounter with COVID, as in most of the country, was in March of 2020.
COVID was so new that nobody really knew what was or was not going to work. So at the beginning, you didn't really know what types of treatments were best, and so we were relying upon information that we received from the CDC and from others in terms of our medical treatments. We were always able to provide that supportive care, and we were very fortunate here that we had adequate ventilators and adequate ability to provide oxygen to patients. So that was never an issue for us. And we were very busy, lots of patients, lots of need for inpatient hospitalizations.
And all too much tragedy as well.
Yes, there definitely was. There was certainly individuals who passed away, and I think there really wasn't a person who worked here who wasn't touched in some way, shape, or form by COVID, either because they cared for COVID patients, or they knew someone, or had a family member who had COVID and perhaps passed away. So it was very distressing for individuals. My son is a medical resident in Chicago, and he got COVID early in March, so a year ago. And at that point, nobody really knew what to expect, and it was very frightening for me. And I was so, overjoyed when he got better and was able to move forward and do well.
Good. Unlike deaths from many other diseases like cancer, in this instance, some of these poor patients had to die alone, and that was something new to everyone, right?
Yeah, it really was. We were trying to do the best that we could to protect the individuals who were hospitalized, as well as individuals who were coming in from the outside, and trying to avoid more people getting sick. And so there was very limited ability for people to have their loved ones with them. And even if they were with them, it was typically for very short amounts of time, kind of bursts of time. So really our staff became the family of these patients. So our staff were the ones that were holding the phone for them so that they could see their loved ones via FaceTime. They were the ones holding their hands. They were the ones connecting them to their pastors and their priests and their clergy people. So it was very difficult for our staff. And while our staff is accustomed to seeing individuals die, not to the extent that was happening with COVID. The volume of patients dying just of COVID probably at some points was 3 times what we would normally see. And so for staff members, they'd have to deal with that during the course of a shift, and it was very hard for them, but they did a phenomenal job connecting people to their families and ensuring that, to the extent humanly possible, that those connections could be made even at the end.
How has this experience changed nurses and doctors?
I think it has highlighted the resilience of caregivers, realizing that when you didn't think you could do it one more minute or one more day, that you really could. I think it helped with innovation, because I think, early on, when personal protective equipment was a little bit hard to come by, and so we had to be innovative and create some of our own. And I think the other thing that it really emphasized the value of teams, and the fact that no one type of provider could do it all. So I think having us all really work together and solve problems together was something that we always did, but I think it was more notable in this particular situation.
But in the end, are you now better caregivers?
I think so. I think seeing what people went through when they were alone without their families, I think it increased our empathy towards our patients. I think that the need to think so quickly to make, quick decisions. I think that affirmed people's skill sets and made them feel more confident in their own ability to care for people under extreme stress and duress. So I think we're better providers for it, yes.
Post-COVID, where is your clinical focus at Excela?
Gosh, well, we want to, of course, keep our eye on the COVID ball and make sure that we're not letting our guard down. But at the same time, we want to move forward. We want to enhance the services that are available for patients in our community. We have a very robust cardiovascular service line. We're able to provide very high-end open heart surgeries, dealing with valve replacements, valve repairs. We can do electrophysiologic procedures, and that deals with patients who have irregular heart rhythms, or what we call arrhythmias.
Yes.
And there's a variety of procedures that can be done for that. We're doing a lot of minimally invasive procedures for vascular work and for lung surgery. We're also focused on cancer care. We want to make sure that patients can receive care close to home, that they don't need to, drive the whole way into Pittsburgh to get what can be delivered locally. We can do chemotherapy, radiation therapy, the whole gamut of surgical procedures that might be needed.
Right.
Of course, we've always had a very large orthopedic program, and so that's something that we do a lot of, and everything has the foundation then of primary care. So people, we have a great primary care network, and so those are our focuses. We want to make sure that we're bringing care to patients right here in town.
Dr. Fox discusses Excela as a magnet system, and Dr. Heather Walker details Excela emergency medicine in a future Heart of Westmoreland video.